when I started, it was very much more directed just to the individual or just to the family. And now when we think about our programming, it's kind of moving away from, the university expert model, but into that more engaging people in community and partners within the community to really identify what those health issues are, and then how can we as a community, as individuals within that community, partner and work together to impact health outcomes in a more positive way.
A K-State research and extension specialist has been helping promote healthy lifestyles in Kansas for 35 years. Gayle Price, currently the state leader for Dining with Diabetes, is retiring later this year. As she reflects on the many health programs offered by Extension, she has seen partnerships work successfully with programs that address opioid addiction, food insecurity, child nutrition and wellness, physical activity, and much more. On today's Sound Living, reflecting on the growth of health programs in Kansas. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman. According to Price, the willingness of many agencies to work together over the years on health issues has paid dividends for the state's communities. Gayle, maybe just to start, a little background on your career with K-State Research and Extension, because it's been varied and you've done a lot of things.
Yeah, Jeff, it has been. I started in a county position in Crawford County with our FNEP program, Expanded Food and Nutrition Education Program, which is a very focused program on limited resource families, particularly with young kids, and helping them stretch their food dollars and make healthier choices so that their families could be healthy. So it was very individualized, working with primarily mothers, but a few dads back then, and that was in 1987, so that's been a long time ago.
One of the real areas of focus, I think, for you has been really diabetes education?
Yes, particularly the last 15 years. Dining with Diabetes is one of our signature programs with K-State Research and Extension. And Dining with Diabetes is actually a national extension program that we were involved with over the years, and then a national working group of other state specialists updated the program, and so we relaunched that program in 2016 in a face-to-face model. It really is a national extension evidence-based program focused at individuals that have the disease of diabetes and also their caregivers and support people that really helps people manage that disease more effectively.
This is one of those diseases that we can really classify as being an expensive disease, isn't it?
Oh, absolutely. About 1 in 10 adults in the country and in Kansas have diabetes. Many don't even know that they have it. And, many people with pre-diabetes don't know they have it, and the statistics are even higher for that. But the cost of medical care for individuals with diabetes is over 2.5 times more than someone that doesn't have the disease. So, yes, it's very costly.
And one of the good things is just making some modifications in diet and other things can really improve their overall health and maybe move them out of that type 2 diabetes situation.
Yes, the majority of people diagnosed with diabetes actually have the type 2 diabetes. And yes, a lot of that can be self-managed with healthier lifestyles. So that might mean just healthier food selection, watching your carbohydrates and your caloric intake, being more physically active, reducing your stress. If you are taking medications, making sure that you take your medications as your physician has prescribed and monitoring that. So yes, much of type 2 can be managed just by some of those simple changes, but it does take that. It is a lifestyle change for those individuals that's trying to manage that effectively.
I don't know if you're solely responsible for this, but a lot of agents across the state are trained to do this program.
Yes, I am the state director for our Dining with Diabetes program here in Kansas. We also have a lead trainer for the program that also provides an immense amount of leadership and training, Sarah Sarr. She's our Extension Nutrition, Food, and Health agent in Sedgwick County. But we have about 50 agents across the state that are trained instructors for our Dining with Diabetes program. And on our website, we do have a list of locations with a Kansas map that shows the counties below it. that has a trained person. So if someone wants to learn more about the program and if it's available in their local community in a face-to-face model, they can go to that website and look at the location map and see where the closest location is to where they're at in the state. But we also have Dining with Diabetes now available online. And so if that mode of programming works for you and it's more flexible because you can, with the online program, there's a start and an end date, but you can actually do the program kind of on your own time and pace yourself within the course.
That's going to be one of those things that you get to talk about in retirement, isn't it? Is how we moved from only face-to-face to being able to reach more people with Zoom and online technology.
Oh, absolutely. And I just yesterday was meeting with a group of agents, and we were talking about how the COVID pandemic and what we've learned from that and how we need to provide much of our content in more of a hybrid or, both in a digital format and in some cases face-to-face for that audience. Because the one thing we have learned because of COVID, and we kind of had started seeing this, and actually Dining with Diabetes, our planning group had already decided to move that into an online program before COVID-19 affected our work, and absolutely has been a benefit for us, reaching a different audience than we do with our face-to-face programming. And that's the case in many of the programs that I was listening to our educators that are at the local level talk about the different programs that they're trying to put into a more hybrid, more digital format. So I think we're going to see more of that, and I think we'll continue to reach a new and engaged audience in a different way, and that's a good thing.
I think we're also starting to see a lot more partnerships form between Extension and smaller communities especially.
When I started, as I mentioned, it was very much more directed just to the individual or just to the family. And now when we think about our programming, it's kind of moving away from, the university expert model, but into that more engaging people in community and partners within the community to really identify what those health issues are, and then how can we, as a community, as individuals within that community, partner and work together to impact health outcomes in a more positive way. So, I think we're definitely getting away from more that individual expert model to more partnerships. We do a lot of work with the Department of Health and Environment and different agencies within that, or different units within that agency. Obviously the Department of Ag, Child Nutrition and Wellness. We do a lot of work in local food access, which is something that's relatively new, working with farm to school, a lot of the farmers markets, and helping connect local individuals with where they can get local foods that are healthier choices for them. And also consider, how does that fit into my budget? Because when we think about health and extension, it's a broad definition of health. It's not just physical health, but it's mental health, and we're really expanding in some of the offerings we're doing there in behavioral health. We have a QPR program, and several of our staff across the state are trained in QPR, which is kind of a suicide awareness and prevention support program. But we're really engaging with more partners as we do our work, and I think it has a bigger impact for all of us and for our communities as far as overall health.
And that's one of the beauties of Extension, is they're able to really target programs at the local level, depending on what that community may be facing, because all of the communities, health-wise, mental health-wise, they face different situations.
Absolutely. And I think that's one thing a lot of our state partners have been reaching out and learning more, because the one thing that our land grant system here at K-State has is that we have a local presence in every county in the state. And so we have a local professional that's in that local unit that can connect. If they're not the expert, they know someone on campus or someone within our system that can provide support and be that kind of information provider as people, as local communities are identifying what are the priorities for us and what does that look like. Whether it's, we have a child care shortage, and so we need to put resources and come together and figure out how we in a community deal with making sure that we have quality child care so that our parents can go to work, can be away and have, jobs that will support their families and also support that community. And so that's a tool that we can bring to those coalitions and partnerships, is that we do have the network of local professionals out there across the state.
And we also partner with other land-grant universities as well.
Yeah, absolutely. As I mentioned, the Dining with Diabetes program is one that multiple states are involved with. There's a national working group. I think 30-plus states now use that program across the country. But almost in every one of our programs, we have specialists networking with other universities to do programming. We have shared specialists in supporting program development and professional development for our staff, not only in Kansas, but also like in Missouri. So yes, in all of our programs, we are always using all the resources of the land-grant system, and that means partnering with our other state land-grant universities. Whether that's curriculum, whether that's training, it really is a wonderful system that has a lot of capacity to support. The other thing we're doing, too, is the last few years, there's been some support from the Center for Disease Control and helping educate individuals on immunizations and the importance of immunizations. And so I really see that partnership continuing to grow.
Are there some pressing issues that we may be seeing in Kansas, you think, health-wise?
Well, I mean, as we've been saying, we know that in the state of Kansas, our population is an aging population. And so the increased health care cost, access of health care, keeping people healthy. I mean, I haven't mentioned our Stay Strong, Stay Healthy program, but keeping people so that they can maintain a quality of life safely in their home is the priority, and to help prevent falls. And that's, as we think about aging, that's one of the issues that we sometimes see is that people fall and then are hurt to the point where maybe they can't maintain their quality of life independently in their home. And so I think, just all the issues around that. Food access, we have areas of the state where they are in what is called food deserts, where they can't access healthy foods. And so it's one thing for us to say people need to really work hard on increasing their fruit and vegetable consumption. But if I live in a community where there's lack of fruit and vegetables and I can't get to the grocery store where, that may be 20 miles away that has those, that makes it impossible for me to follow more healthful guidelines.
Yeah, we're starting to see more and more communities turn to some of the local farmers to help fill in some of those gaps.
Yes, we have a program that's called Double Up Food Bucks, and that's really working with local farmers markets so that people can have the resources to get more fruits and vegetables and to keep those funds local instead of taking them outside of your community to purchase food someplace else, but also connecting the local producer to the individuals. And we're seeing that, whether that's people wanting to buy their own meat directly from the producer and getting it processed, or specialty crops in more fruits and vegetable types of offerings. So our farmers markets, local schools, community gardens, all of those efforts, I've definitely seen a huge increase over the last several years. And so with that, another thing that we're seeing is lots of individuals wanting to learn how to preserve those foods safely. And I mean, food safety is an issue across the board with all of food production, whether it's on the producer side or the consumer side. And so K-State Research and Extension has specialists in the area and provides a lot of training for partners, from producer produce safety programming all the way to consumer food safety and serve safe training for individuals who provide food that's consumed directly to the consumer.
Well, I know that you've had a long career with Extension, and I'm assuming that you're probably still going to get stopped on the street and people are going to be asking you questions.
Well, I hope so. As an educator, as an Extension agent, I always say we're a change agent. We try to keep up on the current science and evidence and information so that we can provide, accurate information to the public to help them make informed decisions about their decisions and their situation. And everybody's is different, but I plan to keep up on my content area in health and nutrition topics, and we'll definitely be cheering our Extension programming from the sidelines.
That's Gayle Price, State Leader for Dining with Diabetes and Extension Specialist at the Southeast Kansas Research Extension Center in Parsons. After 35 years in the Extension system, she's retiring later this year. To learn more about the health programs offered by Extension, visit ksre.ksu.edu. Sound Living is a weekly public affairs program produced by Research and Extension at Kansas State University. I'm Jeff Wichman, and this is the K-State Radio Network.